can be. Dr. Greg Miller is an Adelaide-based dentist and also chairman of the Australian Dental Foundation. Greg, thank you for your time this afternoon.
Thank you, Nikolai.
How many people do have some degree of fear or anxiety about going to the dentist? We've had someone on the text line saying it's a dated urban myth that dental procedures are feared.
Look, sadly, it's not an urban myth. So the NHMRC lists dental anxiety or dental phobia as the most common anxiety that individuals suffer. And about 1 in 7 individuals will suffer from dental phobia or dental anxiety, of which around 3 in 10 of those won't actually attend a dentist for over 10 years.
Wow.
So profound effects on their oral health. Generally, it has a terrible reinforcing cycle, which is that they are phobic of dental procedures. As a result, they end up with poor dental care. As a result of having poor dental care, they have dental problems. And then when they do present, often it's for quite serious infections or multiple broken down teeth or really significant problems. So having a dental anxiety, unfortunately, is associated with poorer outcomes with regards to your teeth and bigger problems.
So where then do those anxieties tend to come from? Is it maybe you had a bad experience as a child, or there was some pain, and so you start to associate, oh well, it hurt last time, so it'll hurt again?
Often it will stem from the fact that there has been a previous negative experience. There's a lot of generational trauma with regards to how patients have been treated in the past. Certainly today we have a much more caring, much more supportive environment for patients. And also we have a lot of adjuncts, like the one that you were talking about today, that have been developed that really help for anxiolysis, or basically reducing anxiety. And those techniques, as well as those other adjunct therapies, such as things like oral sedation, happy gas or nitrous oxide sedation, IV sedation, which is actually what I was doing and am doing today, and also general anaesthesia, along with hypnosis, guided imagery, which the study that you were talking about sort of implements, and positive reinforcement as well, really helps.
Education and explanation, does that play a role as well? If you say, okay, this is what we're going to do, and that kind of takes some of the mystery out of it?
For some individuals, they don't want to know.
Yeah, that's true, actually. Yeah, don't tell me.
But what often individuals want, and patients in particular, is a sense of empowerment and involvement in their own healthcare and in the outcomes and the implementation of treatment. So much of phobia is involved or occurs because of disempowerment. So people take away the power. They, common term these days, gaslight the problem, when in actuality we need to lean in, listen to what our patients are saying, listen to what their concerns are, validate those concerns because those concerns are real, and then explain how we're going to address that. So if someone has a phobia of the needle, a very common question that I get asked is, you're not going to show me the needle, are you?
Right.
And the answer, of course, is no, I won't. But in the past, that may not have happened. Similarly, they may have a phobia of claustrophobia or a feeling of being closed in. So we will take steps to open doors within the room, make sure the room is airy and ventilated, ensure that we work slowly, have a signalling mechanism so that patients can signal when they're feeling a little bit more anxious or when they would like to speak. All of those simple steps can be implemented and really alleviate a lot of anxiety and concern for patients.
And I imagine too that would make things easier for you as well. So there is a sense of kind of win-win there.
Oh, it's a wonderful reinforcing cycle. So we have numerous patients in our new North Adelaide clinic who have had profound and really debilitating dental phobia, and that has led to some pretty nasty problems with their teeth, infections, loss of teeth, pain and suffering. And we've been able to manage that, but not only that, we've gotten to a situation where those patients are now able to come to their regular checkup, their regular cleaning, their treatment. They don't require any sedation. They don't require any other implementations because they do feel empowered. They do understand that things can be done in a way that don't invoke fear, and they've overcome that anxiety. So it isn't a lifelong sentence.
We're getting lots of texts through on this. Rachel says, I used to have terrible anxiety going to the dentist. My heart would race, but then I since found out that I've had a reaction to the adrenaline that's present in some anaesthetics. So now I have anaesthetic without that, and it's so much better, although I do still find myself having to talk myself into going a little bit. Joy says, I find the worst part is the drill. Dentists make you comfy with injections and TV, maybe as a distraction. But then what I hear makes me very nervous. I need earmuffs. So I suppose, as you say, Greg, a lot of this is really tailoring the experiences as much as you can to try and make people feel at ease.
You're spot on, Nikolai. You determine what the concerns are. You do a thorough interview. You validate those concerns. And then you look at implementation strategies that will then overcome that anxiety. And our practice is replete with these skills and techniques, and it enables the patient to feel comfortable, to feel confident, and most importantly, to get the dental care they need. Because the worst thing that you can do with dental treatment is leave it. It very much is true that a stitch in time saves 9. If you do have a problem, it's better to address it early. The consequences of the problem will be far less. The treatment will be far less involved, far less costly, far less invasive, and the outcome or the prognosis, the chance for success will be so much better.
I've had one more text on the text line asking around that idea of pain. Are there some points where pain is unavoidable? There's some necessity there, or should people never feel pain when they go to the dentist?
So there are certain situations where people will present in pain. So they're already in pain. They're distressed. They may well be significantly sleep deprived. They may have really quite a significant infection or some other issue. And as a result, they present in pain. So unfortunately, pain and dentistry are linked. What we then do is we determine what the presentation is and how we can best manage that situation to ensure that it's as comfortable as possible. And sometimes, as I was saying, we have to do treatment under sedation, like IV sedation, which is what we're doing today, where, as an example, we'll be taking out wisdom teeth, we'll be removing teeth, we'll be placing dental implants, or doing fillings or root canals or crowns for people in a way that they're not aware of their surroundings, they're still conscious, but they're sedated and relaxed. And for some treatments, that is necessary.
Greg, thank you so much for your time this afternoon.
No, thank you very much, Nikolai. Have a great day.
You too.